Hello and a warm welcome to this EMIC webinar. I'm Fiona Costello and I'm excited to be your host for today's session. By way of introduction, a bit about me. I am currently Business Development Director at Air Innovate, with coming on to 17 years experience in healthcare, including in the UK's NHS, private organisations, non-profit and international projects. In recent years, I have been involved in a number of digital health initiatives. At Silvercloud Health, the behavioural health platform, I helped expand digital mental health technologies in the NHS during COVID. And later at Orca, the organisation for the review of care and health apps, I worked on a range of digital assessment projects. And it was those projects that led to this wonderful community here that's facilitated by EMIC. So right now at Air Innovate, I'm focused on promoting the use of low-code platforms in healthcare. So for those who might not be familiar, low-code platforms are tools that allow you to build software applications with minimal coding. So it's a bit like Lego. You're putting together existing blocks to create wonderful creations. So today we're going to be talking about a very important topic, innovation through collaborative technology development, a case study of a California county agency's behavioral health services. We'll be diving into how collaboration can spark incredible innovation and drive real change. This session will explore the successful partnership between one of California's largest county agencies, behavioral health services, and Chorus Innovations. Our panelists from Chorus Innovations are diligently working to develop and implement collaborative technology to support organizational efficiencies across the healthcare sector. And as I'm sure we can all agree in this community, collaboration is key to driving progress. And today you'll hear some inspiring stories and insights. But first, a few quick notes. Feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose edit and add your country or area. This allows you to connect with others with similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the chat box. During the Q&A session, I will do my best to include as many of them as possible in our discussion. And I will remind you throughout today's session to use that functionality and ask some questions. And lastly, today's webinar is being recorded and the EMIC team will soon share the recording in the Knowledge Bank. So now it gives me great pleasure to briefly introduce our first speaker, Armin Arevian. Armin is the CEO and founder of Chorus Innovations. Prior to Chorus, he was assistant professor in residence in the Department of Psychiatry at UCLA, director of the Innovation Lab at the Semel Institute at UCLA, and director of consultant liaison and telepsychiatry at the UCLA Santa Monica Hospital. He received his medical degree and PhD in neuroscience at the University of Pittsburgh and completed residency training in psychiatry at UCLA. As an assistant professor at UCLA, his work focused on participatory informatics, an approach that involves patients, providers, and other leaders in directly creating high-quality digital health tools to improve engagement, relevance, and address disparities in health technologies. In 2018, Dr. Arevian created Chorus, a digital health technology platform to support a participatory approach to software development. This platform aims to lower barriers to creating technologies and place people at the center of digital health innovation. Dr. Arevian's work highlighted that the cost, complexity, and expertise required to develop digital solutions were major barriers. These barriers limited who could be involved in tech creation, what solutions were made and for whom, and the overall ability of health systems to innovate and adapt to meet changing needs. So without further ado, I'm now going to pass you to Dr. Arevian. Thank you, Armin.
All right, hello everybody. Nice to be here today. I'm going to share my screen. Thank you for having me. Excited to be here to share some of our work and our background with you all. So we just did some introductions. Today we're going to talk a little bit about Chorus and as Fiona did a great job introducing, the idea around our technology platform, but also this participatory approach, how technology can be participatory, how we can all be involved, and how critical that is to shape what gets created and how technology gets implemented and created and used in the real world for all the care that we're all involved with. And then we're gonna have a section for some discussion. So Fiona, like I said, did a great job introducing, so I won't go into this too much, but my background is in neuroscience research. I am a psychiatrist by training. I've done 25 years of software development as well. And when I went to UCLA, I started the innovation lab to help foster innovation through technology and support folks around that and kind of merge these areas. But it became quickly clear that there was a real need to bring down barriers around tech. I was creating apps and people were like, oh, can you help us make this app? And can you help us make that app? And there was a real need. And then at the same time, a recognition that there were all these amazing ideas that people who are closest to the problem, who best understand the solutions, were coming up with. And so there was a mismatch in what was able to be done, with all those ideas versus the reality. So I created over on the right there is a couple screenshots there of versions of the Chorus platform. And as Fiona said, it's a no-code, low-code way of creating apps and technologies. So you don't need software engineers and a lot of servers and infrastructure, et cetera. So that brings down a lot of the barriers. And with that, a lot more things can be created. And below is actually a picture of us working around a table with one of our community partners in Los Angeles, Healthy African American Families, in one of our early projects, co-creating a text messaging solution to support resiliency within a community, for example. And I think, whether it's a big digital transformation effort or even a focused effort like what you see here, innovation can happen even with small ideas. And in fact, they usually start as those ideas and then they grow from there. So if some of this can feel overwhelming at times, it can be as simple as a few people sitting around plastic folding chairs with our laptops, talking about what we want to create and the best way to do that. All right. So just want to start with the key takeaway, just to help frame things, is creating and implementing technology in a participatory way. That means involving in an authentic way activity by all stakeholders fundamentally reshapes what gets created, who benefits, and is a really important driver for effective and transformative technology in healthcare. We've learned a lot over the last several years. Here's a representative example of some of the groups that we work with. Here are logos. They're largely like counties in the United States. There's states, and then there's counties and cities within those counties. So there's counties, state entities as well, and other organizations like UCLA and other nonprofits or other service providers here. So various scales from larger entities to smaller entities. And we've learned a lot along the way, and we want to kind of share some of that with you today and then explain a case example of how all that comes together. So, one of the biggest things, and this is the driver for Chorus from the beginning, but really, really clear when working in health settings, especially at an organizational and agency level, is that disconnected and inflexible tools leave a lot of gaps. So, health agencies, organizations, they often use multiple tools. It could be their EHR plus spreadsheets plus emails and Teams, Microsoft Teams for chat and paper records, etc. Also, there's usually a lot of like one-off databases that were created along the way to collect different information, and it creates a lot of fragmentation. That also can lead a lot to staff burnout, and workforce challenges are so important in healthcare, trying to recruit and retain talented people to care for folks. And the people they want to care for people, they want to focus their efforts on that, as opposed to navigating a lot of the complexities around how all these pieces fit together. And a lot of this disconnection drives a lot of really low adoption rates, which can really impair our abilities to foster change and improvement through technology. It's another tool. I have to log into something else, and then I have to duplicate the effort. It's not really connected to whatever else I'm doing, and staff are just overwhelmed, and there's that low adoption. So a lot of challenges. the current options for technology implementation typically revolve around three main options or approaches. One is what we see a lot is that groups try to adapt their existing electronic health record. And sometimes this works fine, especially if what they're trying to adapt is closely related to what's going on in a clinical environment. So they might need an extra form or a new note template, etc. So that's one. But often the EHRs are designed to be built and to do a particular thing. So adapting it beyond a certain amount is very, very challenging and usually not very possible. The other option is that they would look for and buy something off the shelf. So let's say they wanted to manage, they have a residential facility and they want to manage the beds, who's in what bed, who's coming in and who's going out, for example. So there are some off-the-shelf software that allow people to do bed management, so they could try to use some of that software. But what we hear a lot even there is while it's a similar workflow, there's always differences. It's, well, our breads work that way, but then these facilities are sort of slightly different. And we also need to kind of refer patients between our facilities, and that's not really supported. And they try to adapt sometimes these off-the-shelf software, and then there's usually very limited ability to do that. So then they can try to cobble together multiple point solutions like that, or they end up, what's very common is, as I was mentioning before, filling in all those gaps with more manual processes, spreadsheets, etc. Like you might have an off-the-shelf software to manage the beds, but then all the referrals, someone is tracking that in a spreadsheet, and then somehow kind of connecting those, trying to manually connect those two things, which gets us back to kind of some of the original issues. At the same time, depending on where everyone is from, the technology implementation happens in context, right? In a real world context. So I have a citation here in the bottom, but this is from the Consolidated Framework for Implementation Research. So thinking about in an implementation science point of view, the thing in green is considered like the thing, right? The thing you're trying to do, whether it's a piece of technology or a new type of service, etc. And then you're trying to implement that, right? But that is happening in a real world context that involves individuals, their motivations, their challenges, their barriers, their beliefs, and needs, capabilities, etc. But also like an inner setting within an organization, the culture of that organization, the resources available, attention for change, etc. And an outer setting, right? So what's going on in the community, what's going on with policy, what's going on with all these other external pressures. And all of this is happening. So the more we can take that into account when we create and implement technology, the higher probability of success. And while we can't control a lot of those factors, what we try to do is focus on the ones that are in our control and that sets us all up for the best chance of success. And we do that through one, adaptable technology. So we mentioned the Course platform. As Fiona said, a low code, no code way to create tools to make it as flexible and adaptable as possible. The other aspect is this concept of this participatory approach, working with groups, finding ways to be there. You see some pictures of us out in the world, in rooms, talking with folks, working with them, sitting around the table, and envisioning together some of things, all mission driven and aligned towards a healthier future, not tech for tech's sake, but actually to help drive change. And so this participatory development approach, and here it's sort of representing those three kind of areas: the platform, the approach, and then a focus on having them come together in scalable ways, is really this inclusive way of working together and thinking through what we're going to create, and we're going to create with rather than for. There's also a paper cited here. So this is part of the research that we did earlier that was published. And there's a series of papers on this if folks are interested in diving a little further. And so coming together, platform, and then the other thing that's important to point out is that over time, through all these shared learnings and working with different groups, there's a lot of commonality too. And so we can start with ready to use templates that represent best practices in the real world settings, etc. So people don't have to start from a blank slate, which can be a lot, but then can flexibly adapt and mix and match those things so that they get a really reflective and tailored solution that's meant for them. And technology is always living. It's a living thing, right? Regulations change, requirements change. The organizations have learnings from running a service for a year or two, and they want their tools. So it's meant to be a continuous, ever evolving process. And this is my last slide that I'll end with here. But just another plug for, who creates matters. And if some of you are, let's say, some of you may be involved in technology development, but even if you're not, I would encourage everybody to try to find ways to be involved, even if it's informing how something gets implemented. And what we try to do is have that be a really open door to have the most people involved, because who create matters, right? So let's say I wanted to create a painting, an ocean painting. This is oftentimes like how technology kind of works. I might commission a painter or an engineer to make something, or a vendor to implement something that they have. And I might say I want an ocean scene and a boat and then some clouds, and they would go off and create something and then like come back with something. And I could say, well, okay, this is close to what I was thinking, or not. But what if I was painting it, right? Instead of commissioning the painting. I have different skills. I'm not like, I don't think I can paint the thing on the left if I tried, but I might start trying, and I might get inspired by the clouds, and then the clouds can take on a whole new shape. And then all of a sudden, like the painting itself transforms, and it's something that I meant to paint all along, that I wouldn't have really have evolved unless I was actually part of this process, part of this envisioning and shaping process. And I end up with something fundamentally different. That's what our belief is around technology. The more folks get involved to help shape those things, fundamentally changes what gets created so that they're more useful, more appropriate, better adoption, and ultimately improve the outcomes and impact on the people who we care for. With that, I'm going to turn it back over to Fiona to introduce our next speaker.
Thank you so much, Armin. I love what you're talking about, and there's something very, very empowering about what you're describing. So next, I am thrilled to introduce Ryan Napier, the head of strategic partnerships at Chorus Innovations. So Ryan has nearly 2 decades of experience dedicated to assisting public and nonprofit organizations to define and achieve their strategic goals. His career is marked by a deep commitment to fostering meaningful change and enhancing organizational effectiveness across various sectors. In his current role at Chorus, Ryan leads the company's business development and strategic partnership efforts, collaborating with state, county, and community-based organization teams nationwide. His work involves gaining a nuanced understanding of the diverse needs of these entities and providing tailored support to help them succeed. So with that, Ryan, I'm now going to pass over to you.
Thank you, Fiona. Appreciate that introduction. I sound pretty good on paper. I'm going to just follow up exactly where Armin left off and moving in on those foundational principles of participatory development and how they actually have been applied with one specific county we're working with in California. And so it really is about this idea of a dynamic partnership. As Armin pointed out, when we begin a process with our clients, it really begins a journey. We really don't know exactly where we're going to end up once we get started. And I think the journey that we're about to share with you is indicative of this opportunity of deep engagement to kind of help shape visions along the way. Where we start with this organization isn't where we ended up. And we began with an initial problem for this. The core problem facing them was a kind of an ecosystem of different resource navigation sites that existed in their community, all of which were somewhat in competition with each other, and none of which were really effective at guiding everyone towards the different resources that were provided by the county and the county partners to all the individuals within this county. It's a large-scale county of about 3.2 million. So there's a wide range of different populations, very diverse in so many different ways, and so many different needs that had potential services available to them. And yet people were struggling to access them. And so on both ends, there was problems. You had the services themselves who were not getting the amount of clientele that they were ready to serve. And on the other end, you had a population that was struggling to find and use and even become aware of these resources that were available to them. And so the county was looking for a partnership of an organization that could help them bring in the community meaningfully into the creation of this, under the theory that bringing the community into the process would help create a site that was reflective of their true needs and address their true needs. And Chorus became the partner. And it really helped define early on what could be done when you brought people together. And so the solution we ended up was this community-led creation of a digital resource navigator. It was an iterative process that was community-centered, large-scale focus groups, interviews, and a network of providers brought to the table, all of whom had a voice in what they recognized to be the needs out in the world. And what became this eventual tool, the navigator shown here on the screen, was truly reflective in every way of their participation. Some core elements that weren't on the original plan were, number one, the number of languages. This is a very diverse population, again, 3.2 million being served. And we originally were going to do English and Spanish, and it quickly became clear that we needed far more language than that. There's a large Vietnamese population in this community, and they were elevated to the front of the page so that you could click between English, Spanish, and Vietnamese. We also translated into 6 others, so a total of 9 different languages were translated for each of these pages. And not only were they translated in the sense of just having a blank translation, we actually created a portal in the background so that people could offer edits and suggestions for the language so that it became truly reflective of the dialects spoken in each of these different communities and truly help narrow down to the more appropriate language on each of these pages in every single one of these languages. Another key element that was brought up by our work with our partners was this idea of curating resources and having community groups curate resources to speak to distinct populations along the way. That has been one of the largest and most successful elements of the program and grows to this day. And then this last piece is that idea for an admin portal for staff to curate, report, and track, and so they can keep the site up to date and manage it effectively, which had been a major problem on the other sites that they had been using. So most everything was around this idea of facilitating and simplifying connections to services. And so part of this piece was also the creation of a link that directly connected individuals to an existing service you'll see it on the screen as links. This idea of a live navigation, so you can talk to a resource navigator in real time. And so we developed the capacity to link them directly through chat as well as phone conversations to those teams. And that kind of led to the next problem what we faced. After we had this site up and running and the county had gone through this engagement and realized the opportunity that it presented for developing meaningful technology that was successful to a wide variety of their stakeholders, they recognized they've got work to do. And in fact, it was that navigator, that live navigation piece, who were living off of spreadsheets and archaic technology and needed something new. And so going through this process, we were able to expedite what we had done for the previous iteration, which again was completed in rather expeditious form. I think we completed the first version of the navigation site, including all of those interviews, in less than 9 months. Full rounds of interviews leading to a fully developed site in that time frame. And they recognized that, wow, if you can turn that around, which was a much bigger scale, maybe you can help us replace these tools that we're using, spreadsheets and this old resource navigation tool, and help support the team while they're on the phone. Because the biggest thing that we wanted to do was start to bring people into their system and have a place to track their exchanges with the system and all the different services that they were accessing through these navigation calls, one of which was crisis. And so within less than 8 weeks in a mission critical environment, we went through this process and developed the first version of the tool. And that tool was built to streamline those daily workflows. And the previous team was working through a variety of different tools. And we've centralized all of those core tools into one single place where they could work in their daily practice. This was an iterative process. This site continues to grow to today. But what we allowed them to do was think through their workflows in a very meaningful way and talk about the most efficient way of accomplishing them through digital technology. And so we worked on minimizing clicks, embedding best practices, and standardizing processes through this UXR, user experience researched informed design at the team level, bringing them in, having them comment on the solutions, offer changes along the way. And this allowed them to enhance visibility and automate the data capturing, both the standard data they've collected, but novel data too. Other points of data that had not been collected before, but offered tremendous insight into the effectiveness of the program by automating the collection of time stamping along the way and the amount of time between follow-ups and things like that. And in the end, that helped the administration simplify reporting and better inform decision-making around a variety of things, including identifying areas of programmatic and resource needs. And once we hit this and they saw that what could be done, not only at the public-facing level, but internally to support workflows, the lights went off. And as Armin talked about earlier, this idea of inspiration, of thinking things through, a vision began to take shape, and they recognized that this workflow tool worked very well for this team. What about other teams? And what about, this system for capturing client information? Well, what if we were collecting it from all different sorts and all different parties, and we were able to streamline workflows across the agency? And that really led to a bold vision where we can iterate and expand over time on each of the different tools that exist in their system and slowly build out a more comprehensive one. And so you'll look, at an original point, each program had maintained cases separately of each other. And then over time, we added to support retaining client data across multiple programs. And then finally, we launched a closed loop referrals and linkages system across an entire service line. And now, having moved through that iteration process, a fully comprehensive vision has taken shape. And so what you see in front of you now is a map of the existing and planned tools to support this county at every level. This represents the comprehensive collection of all the different services that they're providing and within the department. And all of the different service lines will have their own tools to support every key aspect of their daily tasks, all unified into a centralized client and case management. And then that information being able to be exchanged bidirectionally through closed loop referrals and linkages, which includes now all of the partners within the county as well. So being able to connect all of those contracted partners who are providing a variety of other services into this system as well, so that after a moment of crisis or somebody who is leaving an SUD program can be referred to further care and support along the way. So I'll move quickly through this from the top down, but up at the top, you'll see that we've got somewhat of a digital front door. I had mentioned the navigator and the links pages. That's really that first opportunity for engagement on our front door, where that information can be collected and guided into the appropriate service line according to need. That information is collected in the unified client and case management, and then shared through the closed loop referrals and linkages module. But then for each of the different service lines, every box represents their own specific workflow tools to capture a core element of their daily tasks. So you see the crisis system has a collection of tools from acuity screening within the call onto the mobile crisis assessment teams and their dispatch. So dispatching as well as field-based tools. And then bed board and bed management tools for the crisis stabilization units and crisis residential programs. I won't go through the rest of this, but you can get a sense of how comprehensive these tools can address the different elements of daily tasks, automate what can be automated, and streamline the collection and sharing of information beyond that. And that last piece down at the bottom, you'll see the closed loop referrals. How do we extend that care beyond the services provided by the county to the network of partners and others who are available to them within the county? So this resulted in the creation of templates in a lot of ways. So not only are there specific tools, but there was a recognition early on that a lot of these tools are addressing common workflows. And if we create templates that solve the majority of problems, working from the CORS platform that is very flexible and allows for change in an easy and timely manner, we're able to take these core elements of these workflows and repurpose them team by team. So referral and case management is a common problem for all of these different service lines. So we have a centralized version of that that can be tweaked and customized for each of those services to address their core needs, while also helping connect them to their core partners that they regularly work with. Field team dispatch. So not only after we had created the crisis team dispatch, we recognized that the homeless outreach team also needed a dispatch tool and field team modules. And so there was an ability to repurpose those core elements of that tool into another service line. And then same thing with the real-time bed registry. Not only do these work for crisis stabilization units who need to place individuals into bed and have a short-term turnaround, they also work for long-term residential programs, both within crisis and beyond, SUD services and the like. We also recognize the importance of supporting mobile teams in the field. I mentioned the crisis teams and the homeless outreach teams, but also nurse practitioners, anyone else who is going out into the field who has common workflows with each of their different interactions with their clients on a daily basis. Those tools can exist in their hands and again, feed in and out and support both communication, data exchange, and data collection out in the field to streamline workflows for those individuals while they're working outside of headquarters, and then streamline the back end work as well. Some of the key learnings that we had regarding the priorities that were most important to achieve. So some of the key learnings, I mean, I think first and foremost was as we went through this, the ability to unify a system became recognized as the most critical element of what we were doing. You know, to be able to support a comprehensive view of a complex health system, to be able to coordinate care across the entirety in a bidirectional manner, so that, most importantly, a client doesn't have to tell the same story over and over again. We've consistently heard about how frustrating it was from the client's perspective to have to tell their story. And oftentimes we're talking about trauma-informed stories that can be triggering and difficult for an individual to repeat every time they walk through a new door and into a new program. And on the workflow side, that program coordination, you know, where you can streamline communication really helps that individual move from one service to the other or be connected to service in a more timely manner. One of the biggest problems were wait times, and we've watched wait times drop dramatically due to our technology. And then lastly, this idea of co-creation on a flexible technology platform ensures that the tools that end up in the hands of the providers are reflexive of what they actually need. And more importantly, as we've seen with each of these tools, all of which still have a team dedicated to improving them, they can evolve over time as needs change and insights and enhancements become apparent of how to improve these. These are living tools, and they need to consistently be living tools. We're never done with these projects, right? This is something that can consistently be improved over time. And that's what the relationship with this county has demonstrated in the value of working together over the long term with a ever-evolving relationship to the technology. So, impact. The digital system created in partnership with the county reflected their unique system needs for more effective care delivery and uptake. That was the top line, our ability to address that giant population of 3.1 million, to bring in 150 different providers and community-based orgs into the process and have them become champions of the tools that were built. And lastly, to incorporate all the different county programs, extend the number of referrals made on a given year. And lastly, I can't read that, provide more resources out to the community in a timely manner. And with that, I'll pass it over to Fiona. Thank you very much for your time.
Thank you so much, Ryan. Stay where you are. And Armin, I'd like to invite you back, please, so we can now engage in a bit of a panel discussion to talk about some of the themes that arose during both of your presentations. So first and foremost, thank you very much. Hello again, everybody else. As we dive into our panel discussion, I just want to remind you to post your questions in the chat box, and I'll do my best to include as many as possible during the Q&A. But what I'm going to do is I'm going to start off by sort of building on these themes of co-production and participatory development, Armin, could you start thinking about kind of your academic background in this field? Could you talk a little bit about what you think best practice is in meaningful participation, please?
Sure. Well, it could take on different forms in terms of like what's the outcome and then what's the process for engaging folks. But best practices usually involve engaging a broad set of stakeholders. So that's looking at all the different kind of stakeholders that would be involved in the thing that you're doing. It could be internal stakeholders. So, for example, you're an agency, you have different service lines, you have maybe the executive level plus the clinical staff, et cetera. So there's different people that represent different interests. But also, don't forget about the community, right? So the community-based organizations, the other players that are involved that often don't have a seat at the table, and also patients or individuals in the community who aren't part of an organization. What we do, that picture I showed in the beginning of me at the Healthy African American Families is number one. Every meeting we ask ourselves, who's not at the table, and how do we get them to the table? And we want to foster this idea of the bus, right? So we help people get on the bus, and sometimes people get on the bus, sometimes we get off the bus, and that's okay. But how do we get more people on the bus? So I think that's probably the core. And then the other aspect of it is consistency. So finding a sustainable way for everybody to work together, and then where does that output go? So if they make suggestions, or if they think through these, you have a certain structure, then that's where like the technology portion on our side comes in, because we can actually accommodate those changes. And then what we try to do is actually reflect those in real time. So the sooner you go from input to output, then people can see their results in a meaningful way reflected in the tool. That really helps to sustain engagement and that energy, and people feel like, oh, what I'm saying is actually matters and it's actually having input. And then you get all sorts of other kind of very valuable input there.
Amazing, thank you. And I guess, Ryan, from your perspective in strategic partnerships, I think that it can sometimes be a double-edged sword, can't it? When you're involved and engaged lots of different users, you can sometimes get lots and lots of ideas. And then how do you go about kind of reconciling ideas where they don't quite gel, or you have to prioritize? And how does that impact community engagement?
Well, the biggest thing is, as Armin said, is making sure they're at the table so they're heard. And then building that understanding that we are building towards consensus in some degree, and that there is leadership at the table. And so, in our large scale partnerships, there is a core group at the heart, representative of all stakeholders. And so you kind of have leadership from each of those different groups that have been brought into kind of a centralized executive level of that project, who then are the champions, right? And so they're able to help communicate and bring those other teams along. But you're right, there's always going to be some level of conflict of interest around here in most engagements. But the core element we have found is making sure that the voice is recognized and is validated. If their need isn't necessarily directly met, that we try to make sure that we show the overall value of the decisions that we've made and how it can at least address some element of their core concern. And then, the flexibility of the tool often leads to an opportunity down the line to address at individual levels. If they do have the resources, there's an opportunity to address some of those unique needs in partnership with them down the line. But a core element of this process is prioritization. There are only so many dollars available. There's only so much time, and there's got to be a starting point. And so how do we work towards the most appropriate win, as Armin said earlier? How do we get something out there that represents a good idea, a starting point that we can then iterate upon?
And do you find the agencies are very supportive of that process and that they actively encourage it? Because I can imagine that kind of the resources that go into that approach and just bringing the different communities together can be both amazing but slightly overwhelming at the same time. What does that mean in terms of how you engage your partners?
Absolutely. I mean, we've been just shocked, and I think of all of the elements of our practice, the engagement process is probably our shining light. It really is amazing how well people value, I mean, just how much they value being brought in, because it's foreign to a lot of them to walk in and actually be included, and to be to talk to somebody before anything's built and just talk about what this could be and what we need and where my frustrations were last time, and giving them a space to express their frustration. Tech's almost got a bad name these days. There have been so many implementations with so many big promises made in the past that people have kind of wary of anything new being added. And often it's seen, really, one more thing. So being able to bring them in, it's very rare that we come across anyone who doesn't appreciate that process. And so that has been, I mean, especially in one of our engagements right now, we've got providers who have brought into this who are now talking to other states, who are talking to other counties and other providers about the experience they're going in. So that's been very telling to us.
Amazing. I think it's probably a topic of another webinar, but kind of the ROI of solutions that are co-produced and co-developed with users and how that sustains engagement. But moving on from that sort of that transformative impact that you talked a little bit about, and at a broad level, can you describe some of the transformative impacts that Chorus Innovations technology has had on individuals and organizations and the healthcare system as a whole, and how that's kind of influenced their thinking from service model development and services that they provide?
Yeah, absolutely. And that is an evolving story with us as well. We've been around as a company for 5 years, Chorus as a platform for about 12 years, and we're on that journey. So that impact is evolving over time. I'll add a little bit to the last question around the participatory nature of things. I think the one thing also just to highlight is that it's always kind of a sliding scale as well. So the Navigator project, for example, was let's start from scratch and really start first with engaging everybody and really think from the ground up. But then other times, it can be, look, we need to support crisis services for these teams, and this is the approach, and it's relatively narrow, and we'll do the best we can to engage people around that. So it can be modulated and used appropriately. There's flexibility there. Around the impact on the health system, it really varies. So we've had on an individual level, we've had, for example, individual people create a mindfulness app for residents in training, and that was part of their research to have impact on improving mental health and stress levels of training doctors, for example. There's another project around engaging youth who are in the foster system and they're transitioning to adulthood, and how to help them be successful in that. And they have a whole research paradigm around evaluating the impact of that, but connecting them with care navigators and then gamifying it so that they follow different things and they can kind of learn how best to be successful in a way that's engaging with them. All the way to what we're learning around at the enterprise level or the health system level, the ability to have technologies that fill in those gaps, right, between the EHRs and the other things around, but done thoughtfully in a way that works with the different groups so that we really drive that level of adoption and impact, has been great to see. And there's more and more examples of that. So we shared a little bit here, but those are the things that we're continuing to kind of work through.
Amazing. And Ryan, from your standpoint, what role do strategic partnerships play in driving that transformative impact and even recognizing that transformative impacts at different levels within the healthcare system?
Well, it's always looking for something, we're looking for two things. One is, where can we improve what we've built, right? And so as Armin pointed out, the idea of these templates, of these workflows, of these new tools that are coming online, there's opportunity to share them more broadly, because we are embedding best practices in them. And then every time that we do so, we're learning more because we are implementing something different. There is some level of customization in every single one of ours, minimal in some cases, but always something. And we are learning more as we do each of those. And then there's that other element of strategic partnerships that's going out and looking for new problems to solve. You know, in the same way that this system and the templates became part of Chorus over time, we're looking for new problems to solve that will help expand our understanding of the needs out there and help bring new solutions to the table. And so we're looking for people to bring new problems to us and to work with us closely to identify the best way to solve them. You know, and then again, we'll have an opportunity to go out with the rest of the world and improve upon them over time, you know, finding a way that the core elements of those workflows can be reapplied and repurposed in new environments.
I think that that is coming across really loud and clear, the ability to iterate and at pace, in line with this feedback, and how then it influences product roadmaps, and so on. How do you see that evolving over the next few years, and like sort of the innovations and trends that you see coming down the line? I mean, personally, I think that low code is a bit of a game changer from off the shelf products that may kind of meet a level of requirement, but actually, to your point around local nuance, I'd be really thrilled to kind of get your thoughts before we then go into the Q&A from the audience about kind of where you see this going and what are the next big challenges from your standpoints.
I think I can take that. I think one of the main ways is shared learnings, and especially in health, that there's a lot of openness towards that, which is great to see. So we mentioned the templates, but as groups create things, that learnings from different organizations can kind of come together to help inform some common patterns, and people can start from those patterns. And then from those patterns, then build and add to them. So we see that evolving over time as more and more folks start doing this, then there's more and more of these patterns, and more and more of an understanding that everyone can be involved in doing this to some extent too. I think AI is an interesting aspects as well. Always want to mention platforms as delivery models for AI, but also to have those models get incorporated in with local consideration and local concerns, to consider various aspects of those models. I think is going to be an interesting thing to follow as well.
Just to follow up on that, one amazing thing that our county partnership has done is the power of the low-code platform in the hands of the users as well. And so we've created a sandbox on the Chorus platform for this county, and they've begun to create their own tools internally. So they've been trained on the platform, and they're solving their own problems now. And we've got a nice process where they do a first pass at a tool, internally, and then they bring our design team in, and they start matching the design elements and everything else, and then we start iterating from there. But that idea of putting this platform in the hands of the end users as well, that really, I think, when you mix that with AI, I think the future is very bright for truly custom experiences at an enterprise level. And I think it's on its way.
I mean, I don't think that I can follow that with another question. So I am going to go to the audience now. Bear with me while I just go to the first question. So Kia ora from New Zealand, Aotearoa. Did the county cover the ongoing costs for the participatory development of the platform? And when the providers were pulled in, did they have to contribute costs?
Yeah, so the way it works in this particular county is that the providers that are using it are actually part of the county. So the county does provide the cost for their providers. There weren't like extra costs for other providers. Where there was opportunities for external entities to use the tool, all that was covered by the county.
Next question, Steve. Thanks for this great presentation. I love the agile design thinking approach and the many examples of innovation. How did you go about measuring outcomes and value? Was that a core part of your process? Did you find it was always possible to measure outcomes and set goals, or was there space for just doing what felt right?
Right. I think that was a great question. Coming from academia and research, measuring outcomes and gathering data that's validated off of things can be quite challenging, especially if you have certain levels of rigor around that. And that's not always possible. So I would say 100% there was always space for doing what felt right. And a lot of what that was informed through this process. The group came together. These are the core needs. Like, for example, we need to spin up the service. They need to go do their work, etc. So sometimes the outcomes were very common sense outcomes, right? Like, can we actually go out in the field and see these patients and do the things that we need to do, right? As we're working more forward, we're trying to work with groups also to identify some other quantifiable outcomes as well. So we certainly do user research and those sort of usability outcomes. So is the tool easy to use, and do people like using it? Does it have all the functionality they expect? So those things can be measured. That's pretty straightforward. But also how much time is saved, like those kinds of ROI outcomes, time saved, reduction in duplicated efforts, quality of data. All those are areas that are great to include when possible.
Yeah, the timeliness piece
Thank
is
you.
a critical one. I was just add that timeliness piece is a critical one, because especially in moments of crisis, et cetera, that ability to connect an individual to services immediately, and then any follow-up service is another key element. You know, after somebody's leaving a particular program, how quickly can they be re-engaged by the next? And so that's another element of that we can track, because it's an integrated system. How much was the time between, you know, assigning an individual with a referral and actual connecting? And those elements of timeliness really do matter.
Amazing, thank you. And another question, Armin, can you please go into more in detail into how the system streamlined the patient voice to mitigate fatigue retell of their story?
Oh, absolutely. So it's a pretty core piece. So in the county, you know, if you call, there's different services, right? Different programs. If you call a program to get services, usually that involves talking to somebody there, and then you have to say who you are, and then you got to essentially tell your story. So they have a whole intake process, right? They'll ask you your background and your medical history and other sorts of stressors, right? Anything that's going on, you know, and you have to explain all this. And then they may have some services, and then or not, and then you maybe need to call another program, but that program doesn't know anything about that previous conversation you had. So then you have to start all over, and you have to do their intake process. So what we have is basically a coordinated intake system, so that way you can people can tell their story once, they can have the basics in there, and then as they go to different things, their story evolves, and you can add information to it, but it's all in a centralized record essentially. That can really help reduce a lot of that.
Fantastic. I'm going to ask a question now, because I've come to the end of the audience questions. But I think in the spirit of continuous improvement and lessons learned, what advice would you give to organizations looking to implement collaborative and participatory development practices in their own projects? And how would you advise healthcare systems that might, in principle, understand the benefit of the idea, but don't know how to get started?
Yeah, that's a great question. Let me think about that answer, actually. I think that one, it would be good to learn more, try to expose as much as possible about what's out there in terms of what are the best practices for doing this. So the more we all know, the more we feel prepared to go through this process. So whether that's working with an organization to just help walk you through what this looks like, or other sources. The other thing that's possible is to you know, you can start small, right? So that could even be internally with your internal stakeholders, like the different groups or folks that you tend to talk with, like maybe it's IT, maybe it's this group or then that group, is form a little stakeholder committee and say, this is something we're thinking about exploring. Here we think about maybe some of the benefits of it, where we think might be challenges. Are there good maybe first steps of how we might start doing this? And then through that, I think you can usually start small if you want, with a focused area where, you know, maybe it's a little clearer what you want to do, but you want to engage in a participatory way to kind of refine a bit and then go from there. That was exactly the example of the county. They started with the navigator. Sounded like, you know, it was pretty clear they had a lot of alignment on doing that. And then from that, they got really the confidence of like, oh, this is how it works. Oh, okay. Well, how about we do it for this service? And then, oh, well, we can do it like, okay. So then like this and like that, it becomes clear over time. So that's why you want to just start, and then it'll become clearer over time as you get going.
Ryan, anything to add?
Not much other than reinforcing that message of just start, bring people to the table. That really is the key, is making sure it's an inclusive space where fears are elevated early, right? Frustrations are elevated early. Let's make sure we get it all out on the table early and help define what we don't want to do, right? What we want to talk about, those things that we're really nervous about, and that were the things we want to be able to move past. I think that's important, where people feel safe to talk about frustrations and concerns and know that they'll be addressed, maybe not perfectly, but over time they will be addressed. And I think that's how you build trust within in a group. It's that idea of being with friends. You can always say, what you're really feeling, and express yourself in that safe space of a shared relationship. And so I would just say, get started, have those tough conversations, and then build from there, because the group really does end up moving towards the right decision. There'll be conflicts, but they really do end up moving towards the right decisions.
Okay, yeah, amazing. I'm so sorry. I think we're going to have to wrap up at this point. So first and foremost, I would like to say a huge thank you to each of our panelists, Ryan and Armin, for contributing so much value to the discussion today. There are so many sound bites, but my favorite is the concept of working towards a healthier future, and that concept of dynamic partnerships to bring a vision to life, and that is rooted in trust and collaboration and participation, so I think it's very apt that you are at an EMIC event. And Armin, your insights into participatory informatics and the journey of creating chorus innovations has been really enlightening. Ryan, your perspective from the county and the examples of how you engage and what the results were, the impact, how you're going to take it forward. Your experiences and stories, as I say, truly highlight the power of collaboration and innovative thinking. So thank you so much. So that is it for today. It has been such a pleasure having you all with us, and we can't wait to see you at our future webinars. Remember to check the Knowledge Bank for the recording of today's session. And again, thank you. And wherever you are in the world, have a great day and a great evening. And we will answer any remaining questions via chat. So thank you so much. Take care and have a great rest of your day.
Thank you. Bye, everyone.